Hi, this is Eye Dr. J, and one of the most commonly known eye diseases, but least understood, is glaucoma. Now, in January, being Glaucoma Awareness Month, let me break it on down for you. Now, glaucoma is actually a family of eye diseases that causes damage to the nerve in the back of the eyes, which slowly interferes with that electrical signal where the eye actually connects with the brain. So it's the wiring from the eye to the brain that gets damaged. And in most cases, it happens very slowly over time. The clear vision straight ahead is the very last to go. So it's called the sneak thief of sight because people gradually lose their peripheral or their side vision. Now let me explain a little bit more. I love this program because we often show it to our patients because it allows us to show patients that the eyeball is not a solid organ or a solid disease. So the pressure inside the eye happens right in here. So it's a pressure we can measure like air in a tire. And that pressure slowly damages the nerve out here that connects the eye to the brain. So next question, how do we get glaucoma? What causes glaucoma? Well, having a family history is a risk factor, but most people that are diagnosed with glaucoma may not have any family members that have been diagnosed with it. But we do know that the fluid that drains in and out of the eye, right here and right here, a lot of times is clogged up. It doesn't flow freely, kind of like a sink that's halfway stopped up, which causes the buildup of fluid pressure inside the eye. Another thing, you can have actually a physical blockage where the fluid doesn't drain. Not the spongy material, but the physical blockage that blocks the drainage out of the eye of that fluid. How do we treat glaucoma? The most common treatment and initial treatment in most cases is eye drops. And what those eye drops do is lower the fluid pressure inside the eye so that it saves the tissue. It slows down the degeneration of the nerve tissue, or it stops it completely. So basically, when you've been diagnosed with open-angle glaucoma, the most common kind, we want you to outlive your glaucoma. Now, we've been in practice for quite some time, and what we find is that when we find patients very early, before there's any measurable vision loss, they do fine. They do very, very well. And one study that I read actually shows that when you catch it early, the odds are 90% that you can maintain your full functional vision, which is what we want for everybody. Our philosophy is one that we want to preserve eyesight, to handle eye wellness, as opposed to waiting for the train wreck to happen and then try to fix it. So that's the ins and outs. Now, there are also surgical procedures for glaucoma. There's a lot of really nice technology. There's implants. Once you've had cataract surgery, there's what we call microstents that are less than the size of a penny that are put inside the eye that also help the eyes drain. They also have little implants that have the glaucoma medication in it, and it's slowly released over time. So you don't have to continually use eye drops all day, every day, or every day. So that's another nice technology that's happened in terms of those implants that slowly release medicine. And then, of course, there's your traditional surgeries that actually cut into the eye, and they actually cause little release valves from the tissue where the fluid can percolate out of the eyes. A lot of different tools and a lot of nice tools we have. And but if you have any questions, we'd love to take care of you. We do accept second opinions, but most of all, most blindness from glaucoma is preventable. So make sure you get checked on a regular basis, because if you wait till you can't see, that vision that you lost, we cannot get back. And as always, we want you to be well, see well, and be blessed. Take care.